As Barb mentioned, our newest facility in the CTCA, Cancer Treatment Centers of America family of hospitals, opened in the West Valley in Goodyear in December of last year, and we're very excited to be part of the community and the healthcare community in the Valley of the Sun. I wanted to spend just a couple minutes talking about integrative approaches to cancer care. It's an area where there's a lot of conversation, a lot of terms being thrown around, a lot of claims and counterclaims, and I'm not going to pretend to answer all of those questions in 15 or 20 minutes, but what I would like to do is just kind of give you an overview of kind of the whole arena of integrative medicine and talk a little bit about some of the specifics of how those kinds of techniques can be useful for cancer patients. As I said, there are a lot of different terms that have been used. There used to be an official definition of complementary and alternative medicine, and it was things that aren't taught in medical school, aren't available in hospitals, and aren't paid for by insurance. The good news is all of those things are now obsolete. Over 50% of the medical schools in the United States currently do have at least survey courses in terms of complementary and alternative approaches to healthcare. More and more insurance carriers are covering a variety of what used to be considered alternative therapies, including things like acupuncture and others, and certainly more of those therapies are now available in hospitals. So we all struggle for a little bit of a definition of what these kinds of approaches are. We used to use the term alternative medicine, and it meant anything that wasn't part of conventional medical care. But realistically, it also implied an either-or choice. You were either doing the conventional approach or you were doing the alternative. It was something you were doing instead of the conventional approach to care, either for cancer or for other medical conditions. And it turns out that, in fact, that's not how most patients were using these approaches, whether we're talking about mind-body practices, relaxation techniques, biofeedback, nutritional interventions, herbal medicines, acupuncture, any of those types of therapies. Most patients were blending both conventional medicine and these other alternative health practices. And so the term complementary medicine came into pretty wide use in Europe, particularly in the UK. In the United States, we never really adopted that term by itself, probably because most Americans can't spell particularly well. And we'd spell complementary with an I, and then it means free, and that didn't quite fit either. And so what we did adopt, however, in the US was this term complementary and alternative medicine, oftentimes referred to by the acronym CAM. So it was kind of this catch-all phrase that talked about things that were kind of outside the medical mainstream, whether you were using them together with conventional approaches or using them as the alternative. In the last decade or so, the term integrative medicine has really come into the fore. And integrative medicine really talks about utilizing both of these approaches to healthcare simultaneously and utilizing really the best of both worlds. And that is, in fact, how most cancer patients use these kinds of therapies. This is a study, it's now 9 years old, getting a little long in the tooth, but still probably the best survey study overall. This is a study of cancer patients at MD Anderson Cancer Center in Houston, done by Marianne Richardson and her colleagues. And they studied 453 cancer patients that were being seen in the clinics at MD Anderson, and they surveyed them for a wide variety of complementary and alternative therapy usage. And what they found was kind of interesting. Number one, they found that 83% of their patients had used at least one of these complementary and alternative approaches. And even if you excluded things like psychotherapy and spiritual practices, which they had included in their survey, but even if you excluded those as being either non-controversial, such as psychotherapy, or not medical, as in spiritual practices, still over 2/3 of their patients had used at least one of these complementary alternative modalities. A couple of statistics really jumped out at me from this study. One is that 40% of these cancer patients had not talked about their use of these therapies
with the family doctor, their oncologist, or in fact any physician. They were, for all practical purposes, self-prescribing. They were going on the internet, getting information, reading a book, talking to friends and family, and making healthcare decisions that their oncologists were largely unaware of. The second number that jumped out at me was that a quarter of these patients were using 7 or more complementary alternative therapies. And when we get into talking about specific things like herbal medicine, and Dr. Shauna Birdsall will talk about that in a minute, the issues related to interactions between all these things can become pretty significant. Now, this is a study that we did at Cancer Treatment Centers of America a couple of years ago. We looked at 227 new patients coming into our facility, and we looked at their use of dietary supplements, vitamins, minerals, and herbal products. And what we found was very similar numbers to the MD Anderson study. We had about 73% of these patients coming in our doors who were using at least one dietary supplement. And when we looked at people who had also had chemo within the same time frame, the same 30-day time frame, 71% were mixing dietary supplements and chemotherapy. And about 25% of them, which is a shockingly high number, were taking things that were potentially contraindicated with their chemotherapy. And over half, 53%, had not consulted with any healthcare practitioner about the use of their vitamins or minerals or herbal products. Again, they were simply self-prescribing based on information that they'd obtained, but weren't really getting any professional advice. So there's a huge need for professional evaluation and advice in these areas. One of the reasons that this situation exists is that these CAM therapies are largely delivered in what I would call the segregated model of care. You have oncology services, and you've got the complementary and alternative medicine services delivered to the patients very independently, with very little crosstalk between complementary and alternative medicine providers and the oncology community. As a matter of fact, some people would describe a big brick wall between them that really inhibits communication. The model of care that makes the most sense to me, and the one that we've worked at perfecting at Cancer Treatment Centers of America for over 20 years, is an integrated model that puts the patient and the family at the center of healthcare, and then surrounds them with a wide variety of disciplines, both conventional medical disciplines like medical oncology, surgical oncology, radiation oncology, but also things like nutrition, naturopathic medicine, mind-body medicine, spiritual care and support, rehab, acupuncture, massage, a whole variety of those techniques. In and of itself, that's not unique. That's kind of the classic multidisciplinary model. What is unique in this model is that there's a framework of interaction between all of those disciplines that allow